My job is to take patients from the time they've had their amputations through the time that they are walking with the prosthesis. I work with them on strength training, and I work with them then on prosthetic gait training when they receive their prostheses.
I'm an occupational therapist. As an OT, we are part of the kind of rehab therapy team, and our job is really to look at the job of living. So whatever somebody wants or needs to do in a day, and that can be everything from getting dressed to chores around the house to getting out in the community and interacting with work or their family.
My role as a prosthetist here at the Minneapolis VA is to design, fabricate, and fit state-of-the-art prostheses that are customized to the individual so that they can achieve their personal goals.
My role on the team is to evaluate the patient in terms of their medical comorbidities and prognosis, their physical function and deficits, and come up with a rehabilitation plan to help them have the best function and quality of life after amputation.
The role of my position and of my lab's position within the rehab team is looking at how the patient moves. So what we really look at is being a conduit for communication between how the patient believes that they are moving and using their prosthesis and how they are actually moving and using their prosthesis.
My role on the team is to evaluate psychological well-being and adjustment to amputation and disability, and provide short and long-term care and support for individuals who've experienced limb loss.
My role is I'm a recreational therapist in outpatient polytrauma. I serve veterans who have undergone amputations, brain injuries, strokes, or neurological conditions. I work as a therapist to get them back into their leisure activities and things, adaptive sports, things that are their interests.
My role here is to lead research projects and development projects. And my role is also to assist clinical teams with clinical questions that come up where engineering expertise is useful.
My name is Kathy McGuire. I'm a psychologist on the Minneapolis VA Medical Center amputation team, and my role on the team is to provide psychological support and evaluate emotional well-being in individuals with limb loss and disability. I often start seeing a veteran either right before their amputation or shortly after the amputation, and I follow them through recovery and acute rehabilitation, and then also as they transition into the community, and then they have the opportunity to continue meeting with me through their transitions in life. I think what's unique and important about my role is that it doesn't have to be at any one point in the process. It can be anywhere in the process, anytime a need is identified by any member of the team. I can start with a veteran right before their amputation to help prepare them for the amputation emotionally and mentally. I can meet with them right after the amputation to kind of process through some of the trauma of what it's like to lose a limb. And I can follow them throughout the recovery process to help them adjust to each step along the way. The fact that social work and psychology are an integrated part of the team and involved in the rehabilitation process from the beginning acknowledges and normalizes the fact that this is not just a physical change for individuals who've lost their limbs. This is also an emotional change and a change in self-concept and body image, and having psychology and social work involved from the beginning really normalizes that part of the process. One of the things I hear most from veterans is that this can be a really traumatic time for them, and they appreciate being able to access broad, comprehensive care in one setting because it goes a long ways towards easing that trauma and helping with adjustment towards the new normal.
My role as a prosthetist here at the Minneapolis VA is to design, fabricate, and fit state-of-the-art prostheses that are customized to the individual so that they can achieve their personal goals. From the selection of components to materials to casting, obtaining measurements. As a prosthetist, my job is very hands-on. Here at the Minneapolis VA, we're in a unique position because all of the components of our interdisciplinary team are located under one roof. So we are only a phone call or an email away from discussing a veteran's care. Because of that, our collaboration as team members is second to none. One challenge to working with an interdisciplinary team is that there are so many members to our team. Rather than looking at this as a barrier to success, we take it as a strength and identify everyone's individual strengths so that we're better as a whole. The thing I feel like our veterans appreciate most is the fact that they're informed of every step of the process that is involved with their care. From start to finish, they are an important member of our team, and they are the center of every aspect of the care that they receive through our facility. Because of that, they are more willing to participate in the process of their own rehabilitation. The thing that I enjoy the most about working for the VA is that each veteran has a unique story to tell. With each patient, I enjoy listening to their own personal life experiences as well as their time in the service. And I'm proud to be a part of their journey through life.
I think the most important thing that our team has in terms of providing strong interdisciplinary care is that we all respect each other and respect each other's knowledge and expertise within our own disciplines. I will go to team members in terms of the prosthetic prescription. You know, I like to bounce ideas off of the prosthetist because they have more knowledge than me of prosthetic componentry. So if I'm thinking of prescribing a prosthesis and I have an idea for a foot, I may say to Kyle, you know, what do you think of this? If we have a patient who's just had an amputation and we're trying to figure out what the best setting is for discharge, then I definitely want to get the input of OT and PT who are working with that patient to see what they're seeing from a functional point of view. For the veterans, I think the relationships that we get to have are special, you know, providing that lifelong care and seeing patients from before their amputation to when you're first prescribing their prosthesis and doing their initial training for walking to then seeing them go on, you know, sometimes to being involved in adaptive sports. You know, other rehab services may discharge a patient once they've improved or met their functional goals, but for us, we follow our veterans with limb loss throughout their entire lives. Because their prosthetic and rehab needs may change over the course of their life, and we want to make sure that we're always meeting those. I saw a patient who had gotten his initial prosthetic care outside of the VA, and he'd been prescribed a prosthesis and a socket, and then as happens over time, the shape of the residual limb changes and the socket goes out of fit. But his private insurance company wouldn't pay for a new socket for him. So he came to the VA amputation clinic, and we were able to provide that new socket for him and reassure him that we could meet, you know, provide new sockets in the future and always be able to meet his rehab and prosthetic needs. And he was so happy, he told us that that was the happiest day of his life outside the birth of his children. So it's pretty rewarding to be able to be part of this team.
Our job is really to look at the job of living. So whatever somebody wants or needs to do in a day. And that can be everything from getting dressed to chores around the house to getting out in the community and interacting with work or their family. And so lots of different things can impact that for people. And after someone's had an amputation, they may have both physical and mental aspects related to kind of adjustment that we can be working on, pain, other factors that really might impact their ability to do those things that are important to them. One thing that makes our team really unique is the benefit that we have in working for the VA in being able to have such a robust team that includes so many different great, talented clinicians. When veterans are seen for an outpatient appointment, they come in and they're seen by the physician, but there's also a prosthetist there and present, and at least one rehab discipline. So that might be occupational therapy, that might be physical therapy, or might be both. At first, the veteran walks in and sometimes they're like, everyone's here for this visit. But what's great is the left hand knows what the right hand is doing. The veteran really feels kind of cared for, and we can often solve multiple problems all in one visit and be able to problem solve together so that we can actively, with the veteran involved in the process, be making these decisions. You know, some of the barriers that we encounter are also some of our greatest strengths, which is that we just have such a large team and so many different, you know, great minds and great ideas present that sometimes the balance is figuring out how to be kind of efficient and make decisions and be able to continue to move forward, while also wanting to make sure that we have input from the entire team or all the people who kind of need to be a part of it. As a rehab provider, we're often the ones that spend the most time with the patients, with the veterans. And so being able to kind of hear their stories, to learn about their personalities and what makes them tick and what they're really most excited for or fearful that they'll never return to, really places me as an occupational therapist in a unique position to come back to the team with this information to set us up to really meet that veteran where they are at and really meet the goals that are the most important to them.
The motion analysis lab does and my team does is really focus on the patient understanding how it is that they're moving so that they can better communicate with the rehab team. For example, if someone's getting a new prosthesis for the very first time, they might have difficulty knowing how much is 50% of their body weight on this new device. And so it's really hard to understand when you don't have nerves at the bottom of your prosthetic foot telling you that there's 50% of your weight. So the clinician can come down and talk to me and bring the patient down, and we can have them standing on our force plates and looking at the TV. And what the force plates allow us to do is be able to see the forces popping up underneath their feet. And so the veteran then can get that immediate visual feedback of, okay, this is what it feels like to fully load the prosthesis. This feels like when I'm at 50-50 and when I'm fully loaded on my sound side. By collecting the motion data and then pausing for a second to then show the veteran, here's how you're moving with your prosthesis. And now they're part of that clinical team. They're part of their own care. And then that allows our PTs, our OTs, our physicians to go over that film with the veteran to better understand how they're moving. And to have them come in and be able to get that one-on-one customer service, how are you doing? Is there anything that we can do better? And just getting feedback from them. I think that that's unique to the VA. And it's also unique to the VA to be able to ask those questions and for them to have a question about how to use their prosthesis and to come right next door into a motion clinic and get data right away that then they can use and change their prosthesis. So when they leave the hospital, they have not only the best prosthesis that they can have, but the best understanding of that prosthesis that they can have as well. And I think that that's the thing that we are always focusing on is how can we give the veteran who might not be having a great day when they come and see us a great experience and really turn their life around so that when they leave, they have a better outlook than when they came in. It's the best part about working here is that you want to come in and make a difference, and to have that reaction and know that you're making a difference, it makes you want to come back and keep doing it.
I've been able to see veterans that have come into polytrauma newly injured, whether that's a car accident, blast, exposure, and I see them starting out in their rehab. I see their fear, their concern, their worry that things aren't going to be the same and they don't know what that's going to look like. I see the work that my colleagues do with them to begin to teach them skill sets and new ways of doing things. I see them work in the community, and then I'm really lucky because I get to see them as they continue into the outpatient side of things. So we really can take that inpatient veteran who was newly injured or just had a prosthesis or underwent an amputation and take them and be able to actually accelerate them and move them through this whole rehab continuum. I see the veteran who was, 2 years before, going through their rehab initially. Now they're coming with me to the summer sports clinic and they're surfing and they are cycling with their peers again. They're doing things that they didn't think they would have done. If you would have asked them that 2 years ago, the answer would have been no, or perhaps self-doubt or worry and concern, and they are exceeding. We have a golf simulator here in Minneapolis. We're unique as a VA that we have something like this, so we can work here down where our veterans receive fitting for prosthesis and in real time make adjustments while they're working on their swing and their dynamic standing balance. I can work alongside a physical therapist and an occupational therapist. The doctors can come down and take a look at the veteran while they're doing their swing. We can really analyze motion. We have researchers involved to make sure that they're getting the right fit that's going to make them successful when they're out in the community. And then once we're done here, we can go out into the community and we work with our community programs. The VA does support through grants as well that veterans can become athletes if they would like to compete at a higher level. There's not really anything that I see here that we don't provide. I mean, we have access to everything.
What's unique about our team, our research and development team, is that we're located right here in the clinical facility, and we're integrated very closely with the clinical team. In many other centers, research sometimes happens peripherally or in another location, but here at the VA, we can very easily connect with clinical team members, get their opinions of things, get their guidance, make sure we're doing something useful. One thing I say often is, clinicians come and say, hey, do you know what we should be doing? And we say, no, we don't know what we should be doing. Please come and tell us. So engineers learn how to solve problems, but engineers don't necessarily know which problems to solve. For that reason, our research and development team always make sure we have a clinical champion for our projects, or we don't do them. There's nothing like this out there. It is very hard for lots of people working in companies, for example, to get access to clinicians to talk to them, or to get access to patients, to get their opinions of new products. All of that is very simple and easy to do here, which makes it a very unique and awesome place to work. We have the engineering team, research and development team working right here in the same building with the clinicians, but also right here with the veterans who we're trying to improve their care. This really is an ideal place to develop new technologies, the ability to talk to veterans directly, to recruit them into studies as study participants, have them try different technologies. There's nothing more exciting than a veteran getting excited about a new technology we developed, or a new intervention that we've come up with to try to improve their function, to try to improve their participation.
We have everyone in-house. The people who make the legs, our prosthetists, are in-house. If I'm working with a patient and I need to have an adjustment made to their prosthesis, I can call the prosthetist. They'll come up and make a change. If we need to make a change of socket fit or alignment in another way, they'll take the patient with them and work with them individually. We aren't simply a physical therapist working with an occupational therapist who happens to also have some other specialization. We are a group that really specializes in amputee care, and we can focus on that. As a result, our patients have better outcomes than you would see in the regular community. We have this holistic care. We have everything from prosthetic technology to mental health, and all of it comes together to really serve our patients. For instance, an occupational therapist might be working on standing and dressing, or standing and going through activities of daily living. They may come to me to say, is the patient ready to use their prosthesis without a walker? Is the patient ready to use their prosthesis walking while doing kitchen tasks? I, on the other hand, will do the same thing with occupational therapy. I'll go to them and I'll say, are they ready to start working on perhaps carrying something that they might have done in their job previously? I'll talk with our doctors to say, if a patient is getting ready to be fit with the prosthesis, is the patient ready to be fit? We're able to troubleshoot, we're able to understand each other's strengths and weaknesses in such a way that we can then better focus on the patient, and we can get a better understanding of what the patient is able to do or will be able to do as a result. In some ways, we may change prosthetic componentry if we feel that that is necessary. We may change where we're taking them out to walk because we know that through communication with the rest of the team that they have different goals that we may not have been aware of. So together, we really are able to focus on the entire individual. So one of the most rewarding things about working with veterans and working at the VA, I think, is the relationships that I'm building with them. I'm able to really get to understand what motivates them. I learn about their families, I learn about their past, I learn stories that they've given me about their time while in service. And that's one of my favorite things, to be able to really understand somebody. You can find out what motivates them. And then as they get to know you and you build that relationship, you're even more able to provide a rehab atmosphere for them. They're willing to do things that you ask them to do because they trust you. And they also understand that you have their best interests at heart.
The VHA Amputation System of Care is an integrated national healthcare delivery system that provides patient-centered, gender-sensitive, lifelong holistic care and care coordination for veterans with limb loss. The Minneapolis VA is one of 7 regional amputation centers within the ASOC system and provides the highest level of specialized clinical expertise.